This is Nursing 440 and we are Group 005. My name is Sarah.
I'm Elizabeth.
I'm Kylie.
And I'm Emily.
And our culture is China.
So students at the end of this presentation should be able to explain the general description of the Chinese culture, identify health benefits held by the Chinese, recognize traditions that influence health decisions, and cultural bound syndromes, as well as identify dietary considerations, understand the Chinese attitude related to pain, and implement culturally and linguistically appropriate services. And this slide outlines what we'll be talking about in the presentation. The Chinese culture is one of the world's oldest cultures. The culture influences a large span of the continent of Asia. Key cultural components include literature, music, visual arts, martial arts, cuisine, and religion. The values are deep-rooted in the Chinese society. Nurses of Chinese culture are likely to provide quality care if they're cognizant of these values.
As you all know, one of the largest countries in the world is China, with a current population of over 1 billion people. Approximately 1.6 million Americans are of Chinese descent, and here are listed some age structures. And here is listed the statistics and prevalence, the birth rate and the life expectancy. You can see here that males are around 72 years and females are around 77, and the obesity rate is 5.7 and literacy rate is around 95.1%.
The people value traditional medicine in China still today. The disregard of health traditions may lead to distrust in the healthcare industry. Herbal treatments, diet therapy, and use of animal secretions and organs and other folk medicines are still used today. Modern Chinese medicine attempts to merge traditional and modern medical practices.
So you can see here that traditional Chinese medicines are influenced by history, culture, and politics, and even Chinese immigrants from the Western side also integrate it in their treatments. And TCM includes Chinese herbal medicines, food therapy, movement therapies, and acupuncture. And even physicians are huge supporters of TCM, and about 90% report to prescribing TCM to their patients. And one of the many reasons why many patients use it is to as immune booster, and it also used to treat cancer, prolong life, and relieve pain. And many believe that Western medication is stronger than TCM. A lot of people say that Chinese medicine treats chronic and Western medicine treats acute.
Acupuncture is one of the most widely used herbal remedies in China. It is a family of procedures involving the stimulation of points on the body using a variety of techniques, a key component of traditional Chinese medicine that's been practiced for thousands of years. It's believed that acupuncture can help restore harmony in the body and aid a person's curative power. Chinese nurses are taught the theory and the practice in their training. And this is a picture of acupoints that doctors will use in treating different symptoms. Health influences include the old cultural tradition of yin and yang. These are two opposite principles in nature. So yin characterizes the feminine or the negative nature of things, while yang stands for the masculine or positive nature. These things include herbs, food, and other treatments are either yin or yang. So an example of this is during childbirth. So that is considered a yin, and so that they think after childbirth that the woman needs to intake foods that are of the yang to have a balance, and that would include warm fluids. Another cultural tradition is blood transfusion. There's a strong cultural aversion to donating blood. So giving one's blood is considered disrespectful to ancestors. It's thought to contain ki or life energy, and so the more blood in the body, the better. Other traditions that influence health decisions are how we as nurses communicate with our patient. We need to explain the cause of illness and disease. Many patients we will not see them in the hospital until they're very acutely ill because of the communication barrier in the hospital. We need to be the ones that are bridging the gap between traditional remedies and Western healthcare. As Lisa said earlier, that they think that Western healthcare is more for the acute, while the traditional medicine is for chronic issues. We need to help our patients understand medications. They think that Western medication is stronger, so they are known to just take half a dose. We need to understand their customs that influence decision making, and understand norms about eye contact and body language. It's disrespectful to make eye contact with the elders, and so we as nurses need to be cognizant of that.
Influence of religious, spiritual beliefs on healthcare decisions and practices. Confucianism was the biggest religion in early China. It focused on the traditional family and harmonious interpersonal relationships and interdependence. It was focused on ancestors and the growing of family. But when the communists took over in 1949, they actually banned Confucianism, and a one-child family system was now permitted, which means that the whole entire dynamic of the Chinese culture had to be changed. And instead of being a large support group, the support group was smaller. Buddhism, Taoism, and ancestor worship are the most prevalent of Chinese religions, and it's really important for us to recognize these, kind of like the yin and yang, and even things like karma and there are different attitudes related to pain and pain relief measures in the Chinese culture. This culture values emotional self-control and appearing stoic, so many times nurses or doctors will have to offer pain medications continually and periodically to these patients because it's actually against their culture to accept pain medications the first time they're offered. They may not appear to be in pain when pain actually is present, so continual assessment is necessary. Pain is vastly treated with herbs and holistic remedies, as we mentioned earlier. Acupuncture is widely accepted as the first line of treatment for pain, and since the U.S. lacks this in our health system and we don't support the use of this as actual treatment, Chinese patients are hesitant to cooperate and may not trust the doctors here in the U.S. The males and eldest sons are the dominant figure in the family, and they make all of the choices for the actual family. So the nurse must identify who is the decision maker and gain their support, since education is really valued in this family. The nurse must also convey expertise as well as an air of confidence, because they're viewed as the problem solver in the situation or the illness. But it's also culturally inappropriate for them to question authority. So you have to really communicate with them and make sure that they have a clear understanding of the procedure, because sometimes they'll agree with you just out of their cultural means.
The Chinese diet has changed a lot in recent history. In older Chinese history, they had more of a traditional diet, which was rice, tofu, steamed vegetables, and green tea. But now their diet has become more westernized, and because of that, they're seeing an increase in non-communicable diseases such as hypertension and type 2 diabetes. Also, their obesity rate has increased. We know that their obesity rate is still very low, but a study showed that from 1992 to 2002, their obesity rate actually increased by 97%. They have a few culturally bound syndromes in China. Most of them tend to pertain to anxiety and mental type disorders. The first one is Koro, which is sexual dysfunction that they believe is linked to anxiety, but not 100% sure. Shenjing Shuario is a neurotic disorder that causes like headache, anxiety, excitability, irritability, insomnia, things like that. And then Qigong is an exercise that they like to do in China. However, there's something called Qigong deviation syndrome, that if Qigong is performed inappropriately, it can cause types of psychiatric things like hallucinations, insomnia. They've even reported like abdominal pain, discomfort, things like that, and it can last for a couple weeks to a couple of months after the Qigong is performed.
So the increasing non-communicable diseases due to westernization of diet. 75% of total death in China includes cerebrovascular disease, cancers, chronic respiratory disease, and heart disease. And one of the main reasons why is because of the high sodium intake and the increasing prevalence of hypertension, increasing prevalence of type 2 diabetes, and the decrease in physical activity due to urbanization and industrialization.
So based on that assessment, we came up with the diagnosis of risk for injury related to noncompliance, lack of education of Western health practices as evidenced by a high sodium diet, lack of exercise, delayed medical visits, and reliance upon traditional medicine and remedies.
For our planning to help them, we want to obviously encourage them to partake in the traditional Chinese diet because it's considerably healthier than the more westernized diet. The second thing is to encourage the use of a low sodium soy sauce, or to maybe measure their soy sauces, because it's such a huge part of their diet that telling them to eliminate it completely isn't reasonable. Also, we have education on negative effects of sodium is important. Discuss smoking cessation, since 50% of males do smoke, and educate the importance of certain Western medications, especially with the increase in hypertension and diabetes. And then obviously ask about any herbals that they like to take at home and check for medication interactions.
So implementation of this planning has to do with the nurses and how we're speaking with these Chinese patients and how we're educating. So a nurse needs to recognize that he or she will need to spend extra time with a Chinese patient and thoroughly educate on medical treatment. Have the patient repeat educational information back to the nurse to ensure good communication, and the nurse needs to ask about specific herbals that could interact with medication. The nurse needs to be willing to allow holistic and culturally specific treatments. So going back to the first point, this is going to take a lot of time, and in order for our patients to be compliant, we do need to spend that extra time with our Chinese patients. And the patient will understand education and how it applies to their life. The patient will feel like the nurse is trying to push them to change their culture, and the nurse will have a good rapport with her patient because of thorough understanding of the Chinese culture. This is what we're hoping our Chinese patients will understand after they leave from us.
CLASS is the culturally and linguistically appropriate services. This is the goal of CLASS. We chose goal number 4 as something that we felt is very easy to bring in with this culture, because education of our coworkers could really help with this specific culture. So number 4 is educating and train government, leadership and workforce, and culturally and linguistically policies, and participate in an ongoing basis. A way that we might be able to apply this practically is to put together some sort of poster, or maybe talk to some coworkers and educate them on how to take care of their Chinese patients.
Lastly, for our Christian worldview, we chose 2 verses. The first one is Galatians 6:2, which is bear each other's burdens and thus fulfill the law of Christ. The reason we picked this verse is because through research we found that actually in the Chinese culture, when someone in the family is sick, the entire family takes on that illness as a burden to themselves, especially the main caretaker. So when the family comes into the hospital, it's important to see the family as an extension of that patient, and they all should be considered our patients because they're under as much stress as the patient himself.
Our second verse comes from Philippians 2:3, where it says, "Do nothing out of selfish ambition or vain conceit. Rather, in humility, value others above yourself, not looking to your own interest, but each of you to the interest of others." This is really important. Like we said, you have to spend a lot more time with these patients, especially in educating them to make sure that they really do understand what you're trying to say. And as nurses, sometimes that's really hard because there's a lot of things we'd rather be doing or need to be doing, and a lot of times as nurses we might be tempted to skip this step or to cut that time with them a little bit shorter. So remembering the importance of their needs in that.
This is our reference page.